Yeah, because the, I get to go.
And so,
So because I didn't go to the meeting yesterday because.
Do you know?
So my babysitter has to drop off. I have to be out.
Yeah.
So I have to make them say, like, I just started, yeah.
Yeah.
I
know.
And then I retired, so I had no way to get all her kids.
Still spending.
So I just tried to fix them out.
Right. So, I mean,
I'm like, well,
there goes,
there goes that.
Yeah. I'm like, that's fine.
Yeah. So I'm running late too. We'll be there till I'm like, yeah. At 4:15.
And now there's only so much around.
And that was the final trip to McKinley, pick up the person who actually walks on the kids. Not like.
Yes, I'm really like, yeah, stop running around. And I feel like you're saying is.
My mom decided to get a IHSS worker. So now I will have to.
Yeah. Yeah.
And that was after. Yeah, after, and that was after not, or my time. For the entire month of August. For 16 days. It's there. And the. No, because they get the choice, if they want to be the IHSS person, and I know. She doesn't work, these other one, because the other one's friends. And they forgot her, but that's her friend. And it's useless. Yeah, it's like that. Life's been like what you get.
I mean.
I'm getting Ben.
You know,
Not really, I got two. I got some time freed up now, but. On my kids, that's many assignments. I have like. 4 classes.
Not like just.
These all seem like that. These don't seem like. I'm already on that. This one is what.
Yeah, that's what I'm thinking.
Percent homelessness.
I didn't want
This class is purely online class.
And like, wait, no.
So first language, yeah. Here's the. But 100% this one.
Right now, you know, between Sally and Stephanie. I got this.
Isn't my. I got a Howard, I got that, got a $77. Yeah, I think so.
And then I have her still not. And then I have like that fast
Class is the hard class too.
And then. Hey. So, yeah.
And this one was a mess up when I. On each of those, you know, I almost have this one done too.
So I have him. Actually doing good on that. I got high school in Pancho. We all know you. I don't know. I feel like having him 37. Yeah.
He's going for it, so that's. That's his dinner. Right, but he's not the R for associates in that website.
Yeah, so you must marry the car out there.
What is his holiday in law because they're 30 morning, she's on it. It doesn't have to be like out and some. Well, he'll get like some. His FAFSA.
Right. Yeah. Or maybe. Yeah.
I don't create more policy around. Tickets are $50. For all volunteer.
Yeah.
Yeah. Oh, yeah. It was I'll fit.
Yeah.
Oh, okay. Not like you just get it. Okay, well, that's. Thank you, everyone, for being here. It is 12:18 and I'm going to call this Behavioral Health Board meeting to order. Welcome. We are the advisory board for the Board of Supervisors. We hold this meeting on the fourth Thursday of each month, and it runs from 12:15-ish until 2:15. We meet in person at 507 F Street in Eureka. This is a public meeting, and everyone is invited to attend. Members of the public may participate remotely. We have some people there. The minutes and the agenda for all of our meetings can be found by searching online Humboldt County Behavioral Health Board. We provide time for public comments early on the agenda. Public comments need to be limited to 3 minutes and pertain to matters related to the Behavioral Health Board. We ask you to make your comment in a respectful manner. If you have any questions, please contact me or any of the Behavioral Health Board members. And with that, we will move to roll call, please.
John Berger. Here. Henry Story Baker, excused. Dolly Berger, excused. Raphael DiCaprio. Here. Laura Montana.
Here.
Emily Arroyo.
Here.
Jim Bass.
Here.
Billy Johnson, excused. Yvette Kellerman. Lenny Price.
Present.
Peter Stoll.
Here.
So we do have a quorum. We will go around the room and then we'll go to Zoom for introduction of staff and guests. We will start with you.
Hi, everybody. I'm Yvonne Rogers, the Behavioral Health Director in SBC Law.
Hi, I'm Jack Brazil, one of the deputy directors for Behavioral Health.
Hello.
I'm Paul Bernanke, Deputy Director.
Hi, I'm Josh. I'm here. This is my first time being here and it's nice to meet you all.
Thank you. I'm Amy Scott. I'm a second year MSW intern at TAG.
Denasia Dewey, been here before. I'm Lieutenant.
Jess Weaver, I'm also on behalf of HUTC. This is my first time here and I'm looking forward to getting introduced to this. Awesome.
Hello. Laurel Johnson, Department of Health and Human Services. I'm an analyst in administration.
Hi, I'm Kelly Schwartz. I'm the public guardian.
Shalon Lee Smith. I'm the assistant public guardian.
Did you want to introduce?
Hi, I'm Lorraine Zeller and I'm new to Eureka and excited to see what's happening.
Welcome.
we will go online. You can popcorn, we'll start with Sonia.
Hi, everyone. Sonia Levy Boyd, she, her. Our cameras are disabled, so we're not able to be on camera. Like, at least mine is. I am a program manager with Children's Behavioral Health and currently supporting the HC, TACI, and TAY people in the room. I will pass to Jeremy.
Hi everyone, Jeremy Nelson. I'm the Deputy Branch Director for Children's Behavioral Health. And I can pass it to Oliver.
Hey, good afternoon, everybody. My name is Oliver Gonzalez. I'm a program manager for behavioral health, and I oversee the new Behavioral Health Services Act. And I'll go ahead and popcorn over to Sharon.
Hi, Sharon Wolf, DHHS Legislative Analyst, and all of our cameras are blocked by the host, so none of us can turn them on, just so you know, but glad to see everybody there.
I'll go. I'm Connie Beck, Health and Human Services Director. Sorry, I'm not in the room today. I have a cold and I don't want to share it with you guys. Good to see those that I can see though.
Philippa?
Hello, I'm Philippa Watkins and I am an LMFT and I am observing today. I was invited by Sean and I'm also an applicant for the Board of Behavioral Health Board. So I'm observing today.
Thank you. LBHB?
Hello everyone, my name is Manuel and I form part of the CalBHBC staff and I'm just here to observe and I can't see everyone on my screen, so for popcorn, you guys decide who's next.
Okay, I think you're the last one, so thank you
Oh,
very
perfect.
much. Are there any adjustments to the agenda? Then we will move on to public comments. We'll start in the room. Does anyone have a public comment?
I was just gonna say that I appreciate the effort that has been made by staff and the chair and whoever else was involved to try to figure out how to continue having online access, but not have deeply offensive Zoom hackers be able to take over the meeting. So it seems like that might be what's happening. But thank you so much for trying to find a solution so we can continue to have that engagement.
Are there any public comments online? All right. Seeing, hearing none, we will move on to action items. We need to approve the minutes from the 7/24/25 meeting and move it.
Well, second.
Awesome. Is there any discussion, changes? Not a call to the vote. All in favor of approving minutes, say aye.
Aye.
Opposed? Those minutes are approved. Members who are in the room have the annual report. Thank you, I'm sorry for being late. Fine. Jeanette Hillerman has joined us. I know you haven't had time to go over it. It is on the agenda to vote. Not sure. Virginia?
They didn't have it in the packet, did they? I don't. I'm out of that business now. I think what I would, yeah, somehow my name's on here for presenting this meeting, Sean. So what I would say about the document, when you read it, I haven't seen these for the years that I was on the board of supervisors and we got to go through them. I think it's one of the best prepared. It's very clear and concise, not just because I helped with proofreading, but I really like how it went, and I think it really delineates things that were done this year and shows that the behavioral health board is doing the things it's supposed to do and is growing and like keeps maturing to a different level, and I think this is a really good report. It was very current size. I appreciate it.
Are you asking a process question about whether we can approve it if it's not on the agenda?
No, it's on the agenda
Oh.
for approval, but nobody's seen it for like the second round, but also nobody has offered to assist with working on it, so.
Yeah.
That's, I guess that's my question.
They did have opportunities, correct?
But the document itself was not part of the
Packet.
packet. I mean, just out of an abundance of caution, I would say to do it next month or approve it, but provide feedback this month. Is it necessary to approve it this month for some structural reason?
Want to get it done.
Just get it done. Here you go. I mean, it's unlikely to present a legal problem, but
It was run by Christine Messenger as far as is the format of this, which is something different, okay? And they need some time to create the ADA packet that will go online before it gets presented to pursue, so.
So it's just here the first time you've received, right? It's sent out ahead of time.
Is there a way that we can take a vote before the next meeting?
sorry, just so I understand, is it that we want to present it to our board before, like, between now and the next meeting? Is that the reason to do it today?
To the board of supervisors. Yeah, there's a bunch of stuff that has to happen before it can go to them.
But it's not on the agenda yet for board of supervisors, right?
No.
Yeah, so it could come, we could work on getting it on the agenda, I don't know, 6 weeks out, and then it could be voted on next time here. But I mean, it seems like maybe.
I forget, Laurel, what was the time frame? You're gone for a month, right?
It could certainly happen when I'm not around. You'd want at least like 4 weeks lead time, very, very minimum. Starting to get into the holidays, there's just a lot of days that the board is dark. There isn't a board meeting for whatever reason or another, holidays, Tuesdays, etc.
But could we initiate the process to get it on board of supervisors with the plan to approve it at the next behavioral health board meeting? Yeah.
And then I could pull it if it turned out that that's changed.
Okay, because it probably wouldn't get on before after next. Behavioral health board meeting anyway.
So we do have a meeting the first Tuesday in November, which would allow us to look at this at our October meeting and then have it presented. My suggestion would be to take board member comments on it if folks have it now. But to delay approval and then to put it, but we don't really have a consent calendar, but to just put it on the October meeting and hopefully all the comments will have been received today or between now and then. That's what I think.
Okay, so then, since it's an action item, how do we make it a? Does somebody need to make a motion to delay this action item until the next meeting?
Motion, please. Perfect. Can I make that motion? I'll second.
All right.
Then move it to the October meeting.
I like the idea of the consent calendar for some of these in the future, and actually be useful for this board. Potentially. I just hadn't thought about that.
All right. Very much. Sorry that took so long. Last item is approval to send membership application for Josh Rosewolf with the Board of Suits. And Sean, if you could do a little introduction on the step out for just a second.
Sure. Laura and I met with Joshua a couple weeks back and we were in the press. To fully support the membership approving his application. Why don't you introduce yourself?
I'm Joshua Rosewolf. I moved up here 6 or 7 years, basically 2 weeks before the pandemic hit. And I do use the behavioral health services up here and they are fantastic, but there are some spots that I'd like to advocate for working for while I'm here and yeah. You guys have any questions for me later on? I'll offer to answer that.
So since Laura stepped out, I would make a motion to approve Joshua's membership to the board of supervisors.
Second.
Everyone, all members say aye, that approve.
Aye.
Any objections? I would send your application to the board of supervisors. Congratulations.
Congratulations.
Thank you.
And we'll move on to the presentation.
Oh, question, sorry.
Yeah.
Thank you for this, Dr. So I want to make sure because last time, you and I talked, Laura, my membership was, up, and so I don't know if it got renewed.
It was sent to the board of supervisors.
Okay.
We don't always know when.
I'll double check and see if it has already been approved. It was,
Okay.
it would have been on consent, so I'll just look up some of the.
Okay, thank you.
I'll give you like a thumbs up if it was.
Okay, thank you.
Okay, all right, I'll look at the.
Obviously, no, so.
But I don't need making any motions or seconds until I'm approved by the board.
I see, okay. Let me revisit this.
Where are we?
Number 6, presentation.
Right.
Oh, me.
So.
Very excited to have you.
Sit, or do you want me to stand? I'm gonna sit if that's okay.
But come up to the.
Okay.
Yeah, so that we can hear the audio on our YouTube video.
I'm saying just excited to get to meet you since I get to work with Jeff all the time.
Yeah, nice to see you. So I brought with me today, Shalon Lou Smith, who's the assistant public guardian, and we're really kind of a partnership these days. We're yelling at each other through our office wall and just talking constantly, so, we do everything together. So that's why she's here today. So, I hate PowerPoints, but I did one just as an outline so we can talk about it. And then I think what Shalon and I will do is just kind of jump in with some anecdotal information and just talk a little bit about it so that it's not as dry, because conservatorship isn't that exciting. And then if there's questions, we can take time for questions, or you can jump in as well if there's something that you have a question about right then and there. Joe? So basically what we do is we are in charge of providing for safety for individuals who are in the community cannot provide safety for themselves. We work under the probate code and the welfare and institutions code and more the penal code. And we file formal petitions in Superior Court, and Superior Court supervises everything that we do and appoints us as a surrogate decision maker for either someone's person or someone's estate or both. Joe? Conservatorship is a loss of rights. Our office has 3 major functions. So we provide conservatorship services for probate and LPS cases, and those are 2 different types of conservatorship, and we'll talk a little bit more about that. And then our third role is that we serve as a representative payee for Social Security, and we're currently the only agency approved for that isn't funded by a third-party vendor. Once people are on conservatorship, we coordinate and collaborate with other county agencies and other agencies and facilities, and then next. That's just a fun picture of some of the stuff we look at when we go into someone's home. Next.
Those burgers are on.
I guess they are on. So part of our duties are to preserve and manage and maintain real and personal property for people. You know, the title conservatorship needs to conserve, right? So a lot of times we have to preserve the status quo while providing safety. So our job in a general way is anything you would do for yourself, we do on behalf of somebody else. So that could be selling real estate, that could be managing bank accounts, that could be paying bills, that could be hiring a care provider, that could be making a doctor's appointment. Sometimes we go grocery shopping, sometimes we go buy a lady in a nursing home a robe and slippers. So anything you would do for yourself, we do on behalf of others.
Including like end of life decisions, signing polls, those kind of things too.
And even in this last year too, usually conservatorship ends at death. But there is a small section of the probate code that if there's no one to administer someone's estate after death, I can do that as the conservator. And so we did that this year on a couple of different cases and brought in a little bit of revenue that way through fees as well. So I think that brought us in about $15,000. So next. So do you want to talk about this? Okay.
So there's two types of conservatorships, LPS and probate. We get referrals from various agencies for the probate conservatorships. It's usually Adult Protective Services, hospital, that, and then for LPS, it's behavioral health. And then we're also getting more and more referrals from court.
Forensic referrals.
Okay.
I have a question.
Yeah.
Sorry.
Sure.
So sometimes, cause I work with attorneys, sometimes I have people that. Have gotten out of custody or just came off the streets, whatever that need a referral, like I just got one like 2 minutes ago. Need a referral to.
They have to meet criteria. It can't be just, there has to be a mechanism within the penal code for them to be referred from.
Oh, he's requesting.
We don't take referrals from the public for LPS conservatorship. And so if there's a mechanism, certainly for the court to refer that case to us within the code, we're happy to take a look at it, but it's a violation. First of all, if somebody wants voluntary LPS conservatorship, they don't qualify.
So I'm sorry, I'm getting confused with payee.
Payee services, that's a little bit different. If somebody wants a payee, the first step is they need to go to Social Security and tell them that.
Okay.
And once Social Security requires them to have a payee, we do provide voluntary payee services.
And then how long does it take to get it?
I wish I could answer that. Social Security has been really short-staffed since the pandemic, and I used to be able to give you a pretty good time frame.
Now we
I
can't
could,
really predict.
I could tell you, and it might be 6 months after that.
Okay,
So I just don't know when.
okay, thank you.
Yeah.
I'm sorry, do you mind just saying what LPS
Yeah,
is?
we're gonna get there, sure. So LPS conservatorship stands for Lanterman Pepper Short. Those are the names of the lawmaker who drafted the law in the late 60s. It's the same laws that govern community mental health. So the criteria for LPS conservatorship is grave disability, and that's the only criteria. So that means the inability to provide for food, clothing, or shelter due to your mental illness. It's not, yes.
I do apologize for the intrusion. With the expansion of the new definition of grave and disabled, what does that look like to your office? Because now grave and disabled is including an alcohol and drug addiction.
It will as of the first of the year.
Okay.
So we'll be getting referrals for people that have substance use disorders and are chronically disabled or chronically greatly disabled due to that.
Okay, thank you.
So it's not danger to self, it's not danger to others, it's only grave disability. They're good for 1 year. They can be renewed, they can be started by one psychiatrist, they're renewed by 2 annually. There's some due process rights that are built into that and a series of court hearings to get to that point. LPS conservatorship is the only type of conservatorship in the state of California that allows to give someone medications involuntarily, to place them in a facility that has a locking door against their will, and some other things along those lines. It provides for involuntary treatment. It's what a lot of times people refer to as a civil commitment in some states. Probate conservatorship is for anybody
who has an inability to be cared for some psychological or medical reason. And probate conservatorships can last forever. They can also be terminated if somebody's circumstances change significantly, but there's no renewal built into that like there is for LPS conservatorships. So you can have conservatorship of the person, meaning that you just make decisions related to their person. So those would be medical or psychiatric decisions. Conservatorship of the estate, which is money, or both together. And that's probably the majority of what we handle. Next.
So for probate conservatorships, we usually get referrals from APS or the hospital. It's usually due to like dementia or some sort of cognitive decline where they're not able to care for themselves or manage their finances or resist fraud or abuse. Next. So we can either be appointed for just their person or just their estate or both. We would be making decisions on their placement, if it's for person, healthcare decisions, signing consents for medical procedures, filling out polls for them. And this also includes end of life decisions. Next.
Sure. So LPS conservatorship, those referrals come from psychiatric facilities. The code actually says that they have to come from the county 5150 evaluation facility. The Board of Supervisors has designated Humboldt County Behavioral Health as that facility, and so all those referrals come through that. This is a little bit misleading because not LPS can all referrals anymore come after an involuntary hospitalization. They certainly do stem from involuntary hospitalization. When the holds that the hospital can enact on their own have expired, conservatorship is the only option if someone continues to need treatment. So that's certainly a majority of how cases come to us. However, the last 2 years, we're getting more and more referrals through Superior Court from the criminal justice system, and those people are not starting at involuntary hospitalization. So they're coming from the referrals are coming from the courts, and most of those individuals are incarcerated. So they're coming out of incarceration and being released to me for treatment. Yes.
I do apologize for interrupting. How many? I'm really concerned about the unhoused population with mental illness. That is looking at being concerned because of the court referring that. Can you tell me what the size of the pie chart is homelessness?
Well, I mean,
because we're seeing nationwide an uptick.
I don't think anybody's being referred just for being homeless. So remember, they have to be homeless and they have to be unable to access housing as the result of their mental illness. So I've had people that I think meet criteria for conservatorship in the past who are floridly psychotic, but they can tell me what their plan for housing is, right? They're okay with, and they can tell me their plan for getting food, and they're okay wearing the clothes that they have, and they're not gravely disabled. There are a good portion of people that are referred to me that are homeless, but they've got a whole bunch of other stuff going on at the same time.
That's what everything's compound, but homelessness is a part of that.
It's a big piece of it, yeah. So, more and more forensic referrals, penal code changed, getting a lot of people, charges get dismissed, people come to me. Which creates some unique challenges because a lot of times they're unmedicated. So then they're gonna require some stabilization and placement, and you know, they've been accused of crimes. So then facilities are reluctant to take them because of that, and we're putting them in with other vulnerable people. So there's a lot of challenges around that. Kelly, I think there's a question right here.
Yes, hi.
Does a referral insinuate, that they will actually receive conservatorship, or is there an application process or like an evaluation process?
So, for probate conservatorship, there is absolutely an evaluation process that we go through. For LPS conservatorship, those are time sensitive usually because they go with legal holds.
Yes.
So those get filed on the recommendation of a treating psychiatrist without a lot of scrutiny.
Absolutely.
But then the investigation period happens while that person's on temporary conservatorship. So there is some, but the cart kind of comes out, or the horse comes after the cart a little bit. on When that. we do an investigation, we contact family members to provide collateral, request records, all of that. And those, to be clear too, those referrals are coming from people with licenses.
Absolutely.
Yeah, so they're coming from psychiatrists, MFTs, LCSWs. Which is, higher in the food chain than Shalon and I. So we're relying on those people as our experts.
I just saw that police was one of the people that believed that could file for a referral.
No, they,
I don't know what.
yeah,
read.
no, but I am getting a lot from the Superior Court. Yeah. Next. So, once someone's on LPS conservatorship, he, at the Public Guardian's Office, approved placement and facilities. We can agree or disagree to the use of psychotropic medication on behalf of the client as recommended. We're responsible for ensuring that our conservatees have access to food, clothing, shelter, and medical care. I should mention Murphy conservatorships a little bit. Murphy conservatorships are a type of LPS conservatorship, in meaning that they allow for involuntary treatment. However, you don't really have to be mentally ill to be on a Murphy conservatorship. You do have to have been found incompetent to stand trial on a felony case and be considered a risk to the public. And those, again, are renewed annually and can go on indefinitely. And they have the same rights as LPS conservatorship, but they're just a subtype.
Do we as a Humboldt County see a large population in that area?
More and more. That's part of the group of folks that are being, I didn't see one, I've been in the office for 25 years. I saw one until about 3 years ago, and now I think I have 6. So just to put a little bit of that in perspective. Next. Surges. You wanna talk about it? Yeah. So, when we get a case, a lot of times they'll have their own house, and so we will go and always with another coworker, but we'll go into the home, check out things, take pictures. A lot of times we're placing this client, and especially like on the probates, they may never return back to their home. So we're, a lot of times we're selling those homes. So we go and we search for valuables, we're searching for wills, we're searching for information about family members that might be contained in there, especially when you're dealing with folks with dementia and they've already made it to a nursing home. Nobody knows anything about them. And so you're really trying to put a puzzle together. My favorite thing is to go into somebody, when you find a safe deposit box and going through the safe deposit box, because it's really like putting a jigsaw puzzle together. Somebody's got a marriage certificate, a divorce decree, there's a birth certificate, and somebody clipped a newspaper clipping of an obituary, so you can really kind of like put the pieces of somebody's life together. Next. That's a picture of searching through fun stuff. Next. Another picture of a home. Yeah. Next. You see the mold on the ceiling, have been leaked for quite some time. Yeah. Let's keep it in. Next. They're more of like a hoarding situation. Next.
I just like the meerkat on top of that wall. Next. So here's some data and statistics about the populations that we serve and the amount of money that we manage. The case numbers in the office right now are actually a little bit higher than that, and that includes some disease cases that we're still trying to finalize some things. Next. So, this presentation is a little bit old. The referrals, I think, speak for themselves. You can see we get a lot more LPS referrals than we get probate referrals. And actually, we don't end up with that many cases, considering the amount of referrals that we get. Next. And that's it.
So. You go.
I guess I was just looking for clarification. What happens to, or I guess in this example, what would happen to the funds that are generated by selling somebody's house?
So they would be used for the care and maintenance of the conservatee. And then we account for those, right? So the Superior Court reviews those every dime, basically, as does Social Security, and they receive Social Security benefits. The VA keeps track of that too. So depending on the source of the income, we get audited by multiple different agencies.
Cool.
I guess my question, when you're going in and you're meeting with these folks, are they supported? Like how, I guess, this is like a, really traumatic.
Sure.
Sure, and so, like, if you guys aren't, is there like therapeutic support that's also provided in these situations?
So it depends on the situation and the population. So everybody who's on LPS conservatorship, which involves a mental health disorder, all of those folks have a mental health case manager who's gonna help be that support.
Yeah.
And, the majority of people on LPS conservatorship are going into facilities where additional therapeutic support is gonna be provided.
Yeah.
As far as probate conservatorship, that's a whole spectrum of things. I've got people in probate conservatorship who live in their own homes, who don't remember who I am. They just think their bills get magically paid. They're not traumatized at all.
Yeah.
And then I've got people in nursing homes that all they want to do is go home. So, it really kind of runs the gamut. And in facilities, they do their best they can to kind of support people.
Yeah.
Yes.
Go ahead.
Oh,
I'll go ahead.
okay. I've certainly met my fair share of folks who either have some stage of dementia or are struggling with a mental illness but can rally for the interview or
Yeah,
for the
yeah.
moment where they're interacting with someone. I think we've all kind of seen that. How do you effectively navigate that? How do you address that?
It's easier with dementia cases, for sure, because it's been my experience that people with dementia, their capacity waxes and wanes. It can. Some people, it doesn't, but a lot of people it does. And so depending on how well rested they are, how much pain they're in, when did they eat last, and what the situation is, they may react completely differently from day to day. And so it's really kind of looking at their activities of daily living and over a period of time to come to, a good decision about their level of functioning. LPS conservatorship, we've all of us that work in the mental health system have met people who can hold it together for a 25-minute interview and then walk outside and do none of those things that they just said that they were gonna do for themselves in that 25-minute interview. That's certainly more challenging to manage, and I don't really have a good solution for that. We only take cases that are referred to us. So they've already gotten past the scrutiny of the professional by the time they get to us.
So that person is saying, don't think this person is able to take care of their.
And I should say too, that the code allows for us to look at a pattern of behavior when we're evaluating whether or not someone is gravely disabled. So you can look at their history. It's whether or not they're gravely disabled today, but you can take their history into consideration. And so I've been in court before where the judge will say, I remember you, and you told me 4 years ago that
you would take your medication, maybe you did none of those things, so I don't believe. And take that into consideration. I guess.
Hi, so just maybe like from the behavioral health perspective on this too, one of the things that. Just because I was listening to your comment earlier too, the LPS. Act, right, is a very broad law that deals with just involuntary commitment in general. And that includes 5150, which is 72 hours, 5250, which is 14 hours. She's and then conservatorship is the very sort of last step in involuntary commitment, right? So 5150 is 3 days, we can take your rights away. 5250 is 14 days, right? And LPS conservatorship is in here, right? And so when we, from the behavioral health perspective, refer to the, from the guardian's office, a lot of times it is because folks have had those 72-hour holds and those 14-day holds, and they keep coming back to the psych hospital, right? So sort of repeat clients that we serve. And so even when they can hold it together, we sort of have, like Kelly was saying, some history around those folks to know, like, yes, pretty sure if we let you out of here, you're not gonna follow up, or you're not gonna take.
Yeah, very few people are gonna end up on conservatorship during their first hospitalization.
Right.
Something extraordinary must have happened if that's the case.
Well, to clarify, the 51 and 50, those just need to be dangerous to self and others, and the
No, they can be fairly
conservatorship.
disabled.
Well, no, I'm saying, but like
Yeah.
the conservatorship has to be fairly disabled.
Correct.
It can't be those for.
Correct.
So when we say like law enforcement can write 5150s, right?
Yeah.
But they can't write referrals for the LPS conservatorship.
Okay, thank you.
And so they can do the 72 hours, but not.
I must have misread on the list of certified officials that are able to refer for conservatorship, but yeah, I imagine that being placed on a 2-week hold would be plenty of time to be able to analyze a person's ability to. So thank you for the clarification.
No, you addressed, in the latter part of, that. Thank you.
Can you speak to the number of people we have conserved in this county compared to other counties?
More. I can't tell you how much more, considerably more.
Well, I'll just add, yes, considerably
Yeah.
more, and that's been a question for us for quite some time, right? Like, why is that? One example is, we have between 300 and 400 in Nevada County, very similar size, they have 7. So it's substantially different, and so that is, I think, a question that we have spent a fair amount of time internally.
What, I can't remember it now, but Paul pointed out to me the last time I spoke somewhere, the scores they do for the adverse childhood.
Oh, ACEs.
ACEs, I think part of it, Paul brought up, and I thought that was relevant, ACEs scores in this county. I think that contributes.
Humboldt and Mendocino are the 2 highest counties in the state with ACEs.
Yay, we're winning. So over the time, because you've been doing this for a while, what trends have you seen?
I'm certainly seeing right now a trend in forensic referrals.
And by forensic, what do you mean?
The criminal courts, people accused of various different types of criminal offenses. And those are significant, and that is new. We didn't used to get a lot of those. You'd get 1 or 2 a year. And I got 6 last month, so that's a lot, and those are challenging for a lot of different reasons. I think we're seeing on our probate conservator side of things, we're seeing a lot of results of long-term substance use and people being diagnosed with neurocognitive disorders based on long-time use of meth or alcohol, where they've had a stroke, a meth-induced stroke, and their brain is just cottage cheese and they can't care for themselves. It's not funny at all, but Shalon and I, like, every time we get one, it's like the same guy.
It is like
It
the
seems
same
like the
person
same guy with a different name. They're all the same. It's like long-term meth user, history of homelessness,
had a meth-induced stroke. And now cannot care for himself.
Well, that's, I see that.
Yeah, yeah. But it's like the same guy, is what it feels like. Yes.
Can you speak to funding for your work? Where does that come from and? how does that
So,
work?
the majority of our funding, we're a general fund program. Our money comes out of the social services budget. We do get fees. We charge a fee for service. It's sliding scale based on the income that someone has. So we'll charge, conservatives based on their income. We get fees for that. We charge representative payee fees for managing someone's social security, so we take a small amount every month. We also do some Medi-Cal reimbursement through the Medi-Cal Administrative Activities Reimbursement Program, and we get some funding from the state of California for that as well.
Placement costs though for LPS conservatorships. So individuals that are in residential treatment come out of behavioral health.
Yeah, we don't pay for that.
A lot of the probates that are dementia, that's like Medi-Cal billable, so there's like skilled nursing that you bill to Medi-Cal. For folks that need that residential care.
The majority of so behavioral, the LPS folks are unique in that behavioral health actually pays for their treatment. The probate conservatives, the treatment that they get is through generic services like Medi-Cal, Medicare, those types of things, or their own resources that they have are used to fund their treatment.
And I'll just flag, I'm sure we've said this from before, but these placement costs are substantially what contributes to our challenge, our budget challenges, and they're, increasing over time.
Well, and it's a scary time, right? Because we have all these unfunded mandates that have come through with care court changes to the penal code that have increased the amount of referrals and people that qualify for conservatorship. So once people qualify for conservatorship, I'm ethically bound to take care of them, which means I have to place them, which is gonna cost money. And so but no money came with any of these changes, and I think that's even gonna increase again after the first of the year when the law changes.
So when you place people, could you talk a little bit more about where that has to be and what those facilities, are there enough of those facilities in our community, et cetera?
No, there's never enough of those facilities. We're very fortunate that we have really been very lucky in this county in the last year to get both Lighthouse and Hyperion in our community and increase who we can place locally. The issue is that this is not just going on in our county, it's going on all over the state. And so really, placement has become a buyer's market. What I mean is this is for profit healthcare. So facilities want the easiest person to take care of. LPS conservatives aren't necessarily easy. And so anybody that has certain behaviors or challenges may languish. There may not be a facility willing to accept them, which brings another problem because then they're living at separate bylaws, which is another issue. But so I feel like, and I think if you look statewide, I can't remember the numbers, but we have 1/3 of the psychiatric beds that we need in the state of California. So we never have enough facilities.
I just want to say, I'm from 2019 to 2022, I worked at Windsong and worked very closely with Kelly. And I can attest to everything she's saying. It's very, very sad and, and disheartening to see how it really is. Waiting at separate Byrons and it was just really, but I also want to say, it was really nice to see the relationship you have with a lot of your clients. They really, it's just wonderful that you really focus on giving them choices that they still have and celebrating those rights that they still have. And I really, there's some that, we just know that we call you. Hi, Kelly, and I would see this and I would watch them. And it was so sweet, so endearing. So
it's kind of my favorite part about the job, honestly, because I've been there a long time and there's been people who've been conserved a long time. So I have a relationship with people that goes back 25 years. And when you're making decisions for somebody,
their family even embraces you, right? You become kind of a member, and so that is the relationships is really my favorite part. And it's not just the client, it's their families too. I mean, they're really attached to some of their family members.
Nice to see that.
Love it. All right, well, thanks for having us. If there's nothing else.
Thank you so much.
All right.
Good to see your face. I get some PowerPoint.
Thank you, Kelly.
My pleasure.
All right, it is now time for communications. This is the time when behavioral health board members and yak it up about all the stuff they want to share. You want to go, Brennan?
You want me to go first? I got quite a few things, or what, actually two. One is lengthy. Let me pull it up. We have a presented by Legal Services of Northern California, hosted by Hope Center, on Thursday, October 16th, 2025, Know Your Rights. It's, do you rent or do you know your rights? If you would like to learn more about your rights as a tenant and the rights and responsibilities of your landlord, please join us Thursday, October 16th at 10:30 a.m. for a free presentation for the Legal Services of Northern California. And we will be having this via Zoom if people can't be present. There will be a flyer sent out by Joe to all of the board members, and we have a question.
Oh, I was just gonna ask you to repeat the date. It's the 16th.
Okay, yes, sir, October 16th. And second of all, if I mention Assembly Bill 348, does anyone here know what I mean by Senate Bill 348?
Assembly bill or something?
Assembly Bill 348. I have a copy of that Assembly Bill here. It was passed by the State Assembly September 4th with no opposition, and it passed the State Assembly on September 3rd with no opposition, and it was also in committees with no opposition. This has to do with our full service partnership here in Humboldt County, which is doing a wonderful job serving around 250 to 245 people. Doing a wonderful job. But there is, like I said, new laws coming out if this is to be signed. This is a presumptive eligibility for the bill creates a process where individuals meet specific objective criteria and presumed eligible for a full service partnership, allowing providers to enroll them without waiting for full eligibility to be confirmed. Targeted out individuals, criteria of the presumptive eligibility focus on individuals with serious mental illnesses, otherwise known as SMIs, who are experiencing unsheltered homelessness, transitioning from incarceration to involuntary treatment settings for 6 months or more. I really think that this is a wonderful bill. I think that this is something our county is already doing to improve the quality of life. It does have a provision out, let me pull it out. It does have an opt-out where counties with these requirements, exemption request of 200,000 population or less. Our county falls underneath that, which our county last population was 132,380 in 2024. But there is also a provision. This is where I'm asking for our county administration not to opt out on this. There is a protective clause in this. The bill would specify that the county is not required to enroll an individual who meets that presumptive eligibility criteria. If doing so would affect with constitutional medical obligations or court orders, or exceed full service partnership capacity or funding specified. I would like to personally ask county administration if I could sit with those that are doing this wonderful work already and meeting with Jack and our full service partnership coordinator to see where we can fill in the gaps as this policy may possibly move forward. I'm not a person that can predict the future, but when you got 78 assembly members and not one opposed, and 48 assembly members and no opposition, we can truthfully say that this is pretty much going to pass. I'd like to see how we can improve the quality of service along with the quality of life, building a stronger community and a more vibrant county that we all live in. Thank you so much. This is what I had to say. What I would like for this board to consider is to write a letter of support of this instead of an opt-out. Thank you so much for your time. If there's any questions, I'll be glad to address those.
I have a question.
Yes, ma'am.
Sorry, didn't raise my hand.
Oh, that's okay.
So one of the things I'd like to see for better full partnership is at this time, when we have people in custody with mental health or substance abuse, they are not eligible to do an assessment technically outside with an outside entity while they're in custody, because their Medi-Cal is different on the inside than it is on the outside. And so many treatment providers will not do an assessment if their Medi-Cal is not valid.
This full service, this bill will address that. Full service part of this bill aims to ensure access to comprehensive voluntary services known as whatever it takes care, provided through full service partnership. They are prioritizing those that are coming out of incarceration for 6 months or more and or programs, alcohol and drug treatment program for 6 months or more. Now, I may be misquoting that. If so, please correct me. That's what this bill will provide.
Thank you.
Thank you.
Thank you.
Anything, Natalie?
Yeah, today is the first day of the North Coast Stand Down, at the Humboldt County Fairgrounds in Ferndale. There's shuttle service, there's resources for veterans over that 3-day period, haircuts, veterinary support, referrals to other resources, a lot of things. So I'm happy to see that in progress. We got some good news with the passage of Senate Bill 105, which is the budget bill. Basically, our representative and president pro tem still through November in the Senate, Mike McGuire, was successful in getting in some budget trailer items specifically for our community, including $5 million for the behavioral health triage center at Mad River. So the site in Arcata, so it's a one-time $5 million direct payment to the county, and then another $750,000 for Sorrel Leaf Healing Center. So both of those obviously very important in the behavioral health space, and really pleased to see that. There were some other things that he did at the last minute for us and actually took some heat for them. So big thanks to Senator McGuire for that. He'll be transferring the torch for leadership in the Senate to Monique Lemon from the Central Coast in November. So that was big news. Beyond that, things are humming along. I looked through our last 8 or 9 agendas and didn't see those reappointments in there. So I did reach out to the clerk of the board staff to see when it's coming. And when I find that out, I'll let you know and I'll get you. Right now it's showing that we have 3 vacancies on the behavioral health board, but I think it's because I think we might have fewer vacancies than we think, because that might not include the reappointments. But now I'm looking at you and going, I don't know. No, that's right. Okay, so there's 3 vacancies. We're nominating 1, so there'll be 2 seats we're still trying to fill. That's good for me to know because I talk about it a lot.
Yes, preferably take.
Yes, yes, you definitely want, you, great. So, I will follow up though to figure out, this meeting happens during their lunch break, so it's not a great time to get the clerk board staff and then get it used.
I can see that, Vernon's reappointment is on October seventh.
You did see that?
I just found that, just because it's noted on my calendar, not anywhere official.
October 7th?
Yes,
Great. That means that probably both of them are on for October 7th?
possibly, I only see his name,
Oh,
but it's just I mean, not that hers. Yeah, I actually was wondering if Danette's hadn't already been done as well, but I haven't found that, so I could.
Okay, do you actually have access to a system that I don't have
No,
access to?
this is my analyst writing on my
Oh.
calendar.
Okay.
So it's not a system, it's
Okay.
a friendly reminder.
Thank you.
Yeah.
I will say a lot of senior staff have access to what's gonna be on the agenda, whereas the
Yeah.
board members don't,
They
so. Okay, well, I think that's all I have unless folks have questions for me. Thanks, Peter.
See everybody. I'll give you an update on some work we've been doing with the state around the Children's Behavioral Health Initiative. I spoke about that before. That's our $4.7 billion initiative in the state of California. It's doing some pretty revolutionary things that we've never seen done in any other state, which is providing fee-for-service, some billing accessibility with Medi-Cal as well as private insurance companies, which doesn't affect the premiums and the or copays or anything like that of the family. So it's this innovative way for insurance to be able to fund school psychologists, counselors, interventionists, as well as this new workforce in the state of California, which are certified wellness coaches. And the certified wellness coaches is so cool because it's this intermediary place where, I mean, I think of myself, I got my bachelor's in social work, and had I had this type of position, it might have guaranteed my pathway, but giving sort of paraprofessional access and support for low-level interventions and coaching, and then we can actually bill for those services as well. So, and that's what we really lack in Humboldt County, are sort of these tier 1, which are universal or targeted supports. So, so that's really exciting as we watch that workforce grow. We're in partnership with Cal Poly, and in their social work department right now, every student they graduate is graduating as a certified wellness coach. So that then provides opportunity for our districts to capture that and build our behavioral health workforce in rural California. So that's really exciting. So, but there's so many work streams within the Children's Youth Behavioral Health Initiative that sometimes you can be a little detached from the source. And so what was really wonderful is last week, there was a whole delegate of folks that were representatives of the state coming and visiting Humboldt County. And so we were able to take the director for the CYBHI, Dr. Sohail Sud, as well as 10 other folks that he had with him. Some of them were from California Health and Human Services, one being, and then Department of Public Health, one being our own Stephanie Weldon, I haven't seen for a while, so just great to see her. She is she's the Office of Health Equity and Stigma, which works on stigma reduction efforts. She's the tribal liaison. But we also had folks from digital platforms like Saluna or Bright Light Kids, if you've heard of these digital platforms that are free platforms that anybody can access to get support around mental health issues and issues around mental health and wellness. So there were folks from youth justice and various groups. So to have them visit us was really great. And we just had a roadshow, and we went, to our core community school, and we went to Northern Humboldt, and we went to Feathers Native American Family Services all the way up to Trinidad, down to Scotia. And what was really great, I just want to share this with the group, is just seeing the transformation that's happening in some of our local schools as far as building out mental health and wellness and positive school climate. A lot through the action that we have with our prevention and early intervention work. And so it was exciting. And then the next day we had a Humboldt County integration symposium. And so
Some of you may be familiar with AB 2083, but that is our interagency, sort of mandate to work to improve, specifically, mental health and wellness services for foster youth, people identified, but we're really looking at as a county as really involving all student service delivery and building out our ecosystem of mental health supports for students in Humboldt County. So we had representatives from all sorts of agencies, public agencies, public health, behavioral health, education, tribes. And we did a day-long symposium talking about, it's one thing to be in a cooperative stance, it's another thing to be truly integrated in the ways that we deliver services. So how do we build those relationships, the trust, the understanding, all based on a MOU that's being signed through our our interagency leadership team. So I've said a lot there, but it's pretty exciting. And so I'm also going to send Joe a link so he can send it out to all of us. Mathematico is also their research group, and they about a year ago did a case study about the integration or the relationship of service delivery, including tribes, agencies, and education in Humboldt County. So it's a really interesting read and gives us some orientation on where we're doing well and where we can improve. So I'll make sure that everybody gets that. If you ever want to talk about it, feel free to contact me.
Dana. So my name is, I didn't introduce myself earlier, but I am Dana Holcomb and I'm really happy to be here. Right now, I did a whole lot of work in the community for the last 15 years. And I like to say I also have a whole lot of lived experience with a lot of different issues involving myself and also my family. Right now, I'm just really honored to be here and I'm really, really grateful to hear everything. I love listening and learning, and I love that I've been given the opportunity to really listen until January and try to figure out kind of where my place would be. But I'm very honored to be here and I take this very serious and trying to educate myself so that I can do the best job that I could possibly do. Right now, with Patrick's Foundation Incorporated, I have a couple of different homes. Raphael and I've been working very closely together with our ultimate dream of opening up a withdrawal management and social model detox. But we're also very excited about pursuing the sobering station too. So we're currently working on that as well. Right now, the home that we have, we're doing some remodel. It's an old Victorian, so we have windows that we're repairing, kitchen that needs to be remodeled. So it's a little bit on the back burner right now, but we're moving forward on that. So that I've said enough, and thank you so much for letting me be here.
Yeah, so as most of you know, I work at the hospital as the coordinator for the California Bridge program in the emergency department, St. Joe's and Redwood Memorial. And the California Bridge program is having a Northern Rural Regional Collaborative, October 14th in Ukiah. They really want to get a lot of us that are just here in a remote region. Myself, Dana, and a few county members, and Andy Stockton went to the harm reduction summit in Ukiah, and that was fabulous. It was so wonderful. It was just wonderful to connect with our partners that our neighboring partners. There's so many agencies that I didn't know that are popping up in that region, and it was just nice to make that connection. As you know, withdrawal management in Humboldt County is we really need a lot of help with that. So for the past few months, I've been sending anywhere between 15 to 20 people out of the area just for withdrawal management, and that is not sustainable. It is very, very traumatic on the patient. Sometimes they don't even make it to their destination. Partnership Transportation has called us several times saying, the patient told us to pull over, they had to get out, they couldn't handle it anymore. And, then we lose we lose contact with that patient, we can't track them, so we don't know those outcomes. Very, very, very sad, so we're really hoping that, we're able to move forward with the social model detox and the sobering center. We were hoping to go live in October, but as Dana said, there's repairs that just, things are happening. So we're pushing it back, and it's gonna be maybe December, January, but we're hopeful that, we're gonna be able to, make some impact, and so we're certainly moving forward with that. We are still, I still am getting between 4 to 6 folks a week, in the ED for, nitrous oxide poisoning. And these smoke shops are still selling them. And I've been reporting, I've been keeping track, of every case and reporting it to Andy and, EPD. So, I don't know what else we can do, but they are not compliant with, the ban.
So is the nitrous oxide ban only on the small canisters or like the full size ones? Cause my husband brought up a point that they would just be selling the full size ones instead of the small ones.
Yeah, my understanding is that both of them, unless they are intended for culinary use or medical use, those are not supposed to be in the smoke shops. And I'm told that both of those are still being sold in smoke shops, and we're also seeing other, I don't wanna call them designer because that makes it sound like it's glamorous, but designer drugs, like Kratom, that mimics opioids that are being sold in these smoke shops, and they're not being regulated. And they're getting in the hands of younger folk. So that's becoming a big trend and concern that we're seeing in the hospital, so we're trying to keep an eye on that. And
Can I ask a question about that? Did City of Eureka pass the ordinance? Not yet.
Not yet.
not
So,
yet.
so it's not banned in Eureka, just so everybody knows.
It's in the county.
It's in the unincorporated
But
part of the county.
yeah,
We
right.
can't, we don't have jurisdiction over the city of Eureka. So the cities each have to have their own ban. Arcata did pass theirs, so it's Arcata and the unincorporated parts of the county now that are covered. So the bulk of the shops that are in the city of Eureka are not subject to the ordinance. Also, tribal smoke shops are not subject to the ordinance and never will be. If they're on tribally owned property. So those are the sideboards to that, so we will. I think there's some effort to reach out to tribes on an individual basis to ask if there's voluntary willingness to stop carrying those products, but that is it, so.
I'm confused.
And what about Fortune?
Also an incorporated city, so they would have to do it.
No,
Thank you for that clarification.
Oh, okay, yeah.
So the city of Eureka is in the county of Humboldt. And the county of Humboldt passed the ban, or the county of Humboldt passed the ban, but it does work in the city of Eureka. Okay, I don't know, I just.
Has to have their own ordinance.
Yeah, that makes no sense.
It's true of everything in the county, so all of our rules apply to the unincorporated communities. So like McKinleyville, Fields Landing, Samoa, just Myrtletown, so
Okay.
anywhere that's not in the city limits of an incorporated city.
Okay.
Thank you for that
Yeah,
clarification.
yeah.
Now that's-
So that's why we're probably gonna keep seeing it, but I've been, bothering the city of
Thank you so much.
And, I don't think Fortuna has even proposed one, but it would be great to get them moving on it. In fact, I'll talk to Tammy this week.
Thank you so much.
Can I ask one more question about that? What's the uptick like on the new, fentanyl that's, Narcan resistant?
I haven't seen not one case yet of that. So yeah, it's always a yet, so that's not saying that it's not here. We just haven't seen it at the hospital. We're watching closely for any new combinations. And I think that's it for me, so thank you. Oh, do you have a question?
Yeah, is there a way to get in touch about the conference that you were talking about?
Yes, right here, I have, you can send, yes, ask these, and please, it would be nice to see everybody. Yeah, absolutely.
That's what I wanted, for it to go to 10.
Thanks.
Absolutely, thank you.
Sean?
I don't have anything to move.
Yeah.
Well, I have exciting things. I actually sent, Michelle a video. I was hoping, but she's not here, so, recovery happened. It's estimated over 600 people were there. We got to honor the sheriff's department, Humboldt County Sheriff's, the City of Eureka Police Department, Providence, and the ambulance and Humboldt Bay Fire. It was pretty exciting, because whether we all want to admit it or not, we're all part of recovery, and especially when I've noticed that a lot of people, when you read the newspaper or the whatever, Los Coast, look at all of the calls that our first responders get called on. It's gotta be, one, traumatizing, but it must feel awful because they never really see the other side. And so, there was a lot of tears, and gratitude on both sides. And really, it's not even a side, it's about a community. And so, it turned out really well. And so I'm just really grateful that I got to be a part of, something so much bigger than ever envisioned in the beginning of 2017, there was that gig. So yeah, I just wanted to share my gratitude for the community that pulled that together. That's it.
Virginia, I don't have anything to report other than to leave early, I'm sorry, but I'm here. I'm here today. Excited, and I am here.
The Behavioral Health Board also tabled at that event and just wanted to let the board know that it was a successful event and thank the board for supporting us.
Yes. Awesome. So May 13th, you were reappointed, so that's for.
Of this year?
Yeah.
Okay.
Yeah. And
Thank you.
you're covered.
Thank you.
You might have just gone almost to it.
I went almost that far back, but not
And then
quite.
did some business.
And then Vernon's up on October 2nd.
October 2nd.
Which will be.
I just
Very well
remember having the conversation and so many months have passed, I was like,
Yeah.
maybe I should ask.
All right, news that I have, Recovery Happens was awesome. Thank you very much for acknowledging first responders. That often doesn't happen, we're acknowledged in that best way. We have a behavioral health board flyer. Laurel helped facilitate this, and we have business cards and email.
Yeah.
People can email us. So there's some piles for people.
With all our names on it.
When you quit in 3 months, so that is, that's a huge deal. It's gonna make my life easier instead of writing, in people's hands. Hey, contact me. So thank you very much for that. DHHS. That's what I got. Now, I think Director Beck is still on the line. It's time for your report.
I am still here, thank you. Is our public guardian still in the room, or did she leave?
11.
Okay, I always want to appreciate them because they do a lot of really hard work for us, so I appreciate that. I was going to speak to what Natalie spoke of around Senator McGuire and us. We are so fortunate to have him, or, until we don't. He has brought so many funds to Humboldt County and specifically around behavioral health. So I was even thinking as a board,
Yes.
your behavioral health board may choose to write a letter and thank him for his support. I always send him emails after and say thank you and sorry for the bad media, like like on this one. But I think that he would also appreciate just hearing from you if you wouldn't mind sending a letter. I don't know if that has to be agendized or what, but you guys can figure that out. Then the other thing that I just wanted to say is, this morning I spent some time in a children's continuum of care meeting. It was called the Northern Region Continuum Project. And we were in this meeting with a number of other county staff that do the same work that we do. And just listening to, and we had more staff on the meeting than other counties had, and participating, and then just the number of things that we have done over the last few years to build continuum of care for not just children, but adults too. I just want to recognize and acknowledge and give kudos to all of the staff that have been doing this work for, I mean, it really has taken years. I think Sorrel, we wrote the grant with Sorrel. I don't know, Jeremy, it's probably been 6 years ago or more. And that's gonna finally get off the ground. So I just, you know, we're going to have crisis residential for children and adults. We have an STRTP, which is a group home for children. Actually, we were even talking about regional center has a home now locally. We don't have to send kids that need regional center care out of the area. I can't say enough. So all those folks that are sitting in that room right there, you should look at them and say, wow, thank you so much for working so hard. Because we could just come to work every day and just go along and do work. And we do so much more than just work. So I just want to appreciate it.
Thank you. Here, here.
Yeah,
Thanks.
that's all I got.
All right. And that goes back at you, Connie, the gratitude.
Mid-November is Senator McGuire's passing of the torch, so if somebody wanted to work on a letter for next month.
Yeah, October, yes.
For next month's agenda, then it would be there in plenty of time.
I would bring a letter if somebody wants to work on it with me. Oh, good. All right, I'll bring a letter for approval.
Okay,
All right, then you up.
well, I too want to underline, my appreciation for Senator Ware's support, and it's not just these things, it's been over time, like really for years, he's partnered with us, and every ask that we've lifted, he's done his best to respond to, so I feel really grateful for that, but the other thing it made me start thinking a little bit about is I often get asked by other county directors about just like, you know, what's the culture like in Humboldt County, and what are your struggles or challenges, and they often ask me, well, what is your board of supervisors like? Like that is a question, and I really appreciate that I feel like I can say now that I, as a behavioral health director and as behavioral health in general, get so much support from our board of supervisors, and I don't know that that's always been the case, like not pointing any fingers, I think partly over time, it's hard to quite understand the complexities of behavioral health, right? Like there's so many elements to it, and what we see in the world, and the stigma and discrimination is so impactful, and it's really, it can be hard to like lean into that, especially in a position where you're feeling responsibility for things that happen in your community. But I just feel like our current board of supervisors, and certainly we've been doing the new Rutland board as well, and Supervisor Arroyo, and the other four are just all so present and compassionate and kind and willing to listen and willing to also speak up and speak out and support the work that we do in a way that feels incredibly supportive. So anyway, I feel grateful for that. I want to flag that along with Senator McGuire's support. Let's see, there's a couple other just random things that I'll say. One is we have California, Cal HHS, the HCS of the state coming in a week or two. It's October 2nd. To look at our CarePort implementation, which is great and scary all at the same time. We have a few teams that will be there to meet with them and kind of share how we've implemented CarePort in our community. We're gonna have some of our partners, including Laura and also Jacob Rosen, who will come and speak a little bit about how they're working with us from the community perspective. So anyway, I'm looking forward to it. It's felt a little daunting, but I think it will be good to be able to interface with them and also share the challenges and our concerns and our strengths. I think that they're coming in part because they see us as having some strengths around petitions and implementation. So that's good. I also wanted to mention that this is a little more in the weeds, but our focused audit that we've been under for several years now, it feels like a decade, both in our adults and children's system related to timely access to care, that has been fully resolved. And so I again, kind of as Connie's mentioning, I just have so much appreciation for the hard work of our staff, because it's just been such a heavy lift, such an incredible amount of work and under really intense scrutiny from the state. Like sometimes I feel like that's more work than just the work itself, is having to report out and be under scrutiny day after day. So I wanted to mention that, and then I guess, I don't know, I guess that I don't really have anything else, except that I wanna just point out that Jeremy Nelson has returned as our deputy director for children, that he's on Zoom. You can't see his face, but super happy to have him back. It's gonna be pretty amazing to have him step up into that role. I think that's it.
Glad you mentioned that because I saw his name up there
Yeah,
and I was wondering.
what? Okay, yeah. He's giving himself a thumbs up.
Good to be back. I am here.
So that's it.
All right. So you have a question?
I have a question for our director. I know the behavioral, I know that the board of supervisors listens attentively to when our directors and deputy directors have to say in support or in mainly when there's questions of opting out of certain bills. Are you familiar with Assembly Bill 348? Would you be willing to sit with me and discuss what this bill really looks like and to see where our county is going in that direction?
I need to probably take a deeper look at the bill. I'm a little bit familiar with it. I think you're much more familiar with it, which I really appreciate, but happy to have more conversation about how to have some meaningful dialogue about it going forward. Sure.
Other deputy director. Oh. Yeah. You call.
I'll just a couple things. Mist is doing really well. They're 24/7 and responding throughout the county, and we brought on a new clinician on that team, so she's getting fully trained, and so that's exciting. Team's been collaborating well with our tribal partners and law enforcement entities, and so it's exciting to see that team grow. And then also, we are working on implementation of SB 43. And so, as you know, we're bringing that component of law into play here in the county in January. So we just met this morning to work on the law enforcement training that we're going to be rolling out in December, early December. So that collaboration been going well. So we have our next steering committee is in a week or next week. So we'll be continuing that work for rollout. That's all.
Good job. Anything, Doug?
Yeah, I too want to maybe just second what Connie was saying about public guardian's office. I meant to do this while they were there, but that's very typical. That's how Kelly was just like, no questions, great, see you guys. No, they worked really hard and, another critical part of that team too is the county council's office, right? So, we have staff meetings every week and the things that these folks talk about, it's like a law office, right? Like a trust attorney reviewing files with, the guardian on all different types of legal processes and I's that get dotted and T's that get crossed. It's a pretty wide ranging, big scope program, in terms of what they do. So anyway, they work really hard and really like your. And Sean. So I'll say that, the other thing, that's just kind of been on my mind, I went to Sacramento. A couple weeks ago, they were of course expecting me and, rolled out the red carpet. But, so we went there on transitional rent. So this is kind of a big deal in terms of, this is connected to the Behavioral Service Act funding that's gonna change, so the rules and regs related to Prop 1, that are changing, with Mental Health Service Act and Behavioral Service Act. So, it's connected in the sense that that partnership health plan is now offering a benefit for transitional rent. So they're gonna help individuals who qualify to pay for rent. And that's a 6-month benefit and there's around that, related to homelessness, fair market value of rent. But then the idea is that Behavioral Health Service Act take over those payments after the 6 months. And, so that then starts to get into our bucket of funding that's, designated a lot for our full service partnership already. And how we're gonna kind of navigate that, coordinate that. So we're working on that. That's gonna take some meeting for partnership to talk that through, that coordination, but it's kind of a big deal in terms of ensuring that we are coordinating with partnership and all counties need to be there. Managed care plans and so we'll be working on that, but just trying to figure out that change in law, its impact. A lot of our full service partnership dollars right now currently go towards housing. And we feel like we do a lot in terms of, that funding, funding for housing for homeless already. So how that impacts will be pretty big. So. This is it.
Generally, sorry, she has a question. She has a question.
I was just wondering really quick if you could touch on how that legislator impacts the creation of this program, or that is too complicated.
You mean like funding pool or?
Like how I believe it was Proposition 1 in SB something that you mentioned specifically the behavioral.
That's 243.
Yeah, do you know exactly how like that legislator influenced the creation of this partnership transitional rent program?
Yeah, I think the partnership transitional rent is it's a Medi-Cal benefit, right?
Yeah.
So it's rolled out to any eligible Medi-Cal beneficiary, and again, there's homelessness criteria tied to that. That though is distinct from, but connected to, Mental Health Service Act, Behavioral Health Service Act. So once we get January 1st, we're gonna change the name and, Behavioral Service Act, and, those dollars used to be allocated in a certain way, and now they're getting changed because of Prop 1. And what the expectation is that we're gonna link those to the transitional rent benefit to the Behavioral Health Service Act money in order to help keep people housed.
Absolutely.
So
Gotcha. I was just wondering about the
Yeah.
connection.
Thank you.
Thank you, Jeff. Jeremy, anything for us?
Well, I've been back on the job for about 10 days now, so a little bit of a whirlwind, getting caught up to speed on what's going on. I think several of the exciting things have already been mentioned. I know Connie mentioned the meeting we were in this morning around regional efforts to expand the children's continuum of care and see how counties can work together. And that's just kicking off, and that's exciting. Peter already mentioned the work that was happening through the schools and with the interagency leadership team. So there's a lot of collaborative work going on, getting back up to speed with some of the things going on with behavioral health and child welfare and probation to serve system involved youth. So a lot of efforts to just continue to improve those services. Even on a smaller level, where we have a project right now to expand and enhance our certified peer support services. So there's a lot of work being done to again, just to expand and improve on the services that we have, and just want to appreciate the work that Martin Stefan and Sonia Levy-Boyd, there are two senior program managers, and Martin was the interim deputy director. I know the two of them had a lot of things on their plates, and so it's been just great to get connected back with them and with Emmy and Paul and Jack again, and the work that they're doing in Humboldt. Just a lot of the great things going on. So I look forward to diving back in and working with all of you again.
Thank you, Jeremy. It's great to have you back. And that's that. Thank you, everyone. SUD committee update. I don't know.
So Danette had to step out, she had a urgency at work, but nothing really to report. We had, as Danette said, we had a wonderful recovery happens. We also had a wonderful turnout for International Overdose Awareness Day, which happened in Old Town this year at the gazebo. And I think there was between 150 to 200 people there. It was a nice turnout. So yeah, we're hoping to get even bigger this year. I think there's talk about moving to the Arcade Plaza and, reaching that population. For this month's SUD meeting, she has scheduled Vinca Care to do the presentation. That's all. Thank you.
Very good. Thank you. So I think executive committee, we supposed to have a new person that we put forward, and then we'll have two openings, and we are really looking for some that are interested. I'm gonna plug that until I get some Google. Let me give you my card. The only other thing I have is that I went to CIT, train the trainer, so that's crisis intervention team, train the trainer. Last week in Tempe, Arizona, it was 101 degrees, it was impressively hot. Was very happy to come back home. There were 20 of us from all over the United States, and we did have someone from Ontario. And again, to reiterate what I usually say is we are doing really good work. Our, MIST 24/7, CSET care, all of that. There are so many places that are just starting. A couple people in Florida, Pennsylvania. Oh my goodness, they need a lot of help. But it was awesome to be there and share the programs that we're doing. I learned a lot, so I'm gonna revamp CIT training, and I'm super excited about that. And then, yeah, and I guess I'll say Montana, they've got it on us, but all right, we have those.
We have the ocean.
What?
We have the ocean.
That's true. That is very true. So that's what I have. And I want to say a shout out, thank you to NAMI who paid for my tuition. My department paid for the travel, so that was a great collaboration also. Thanks. Going to unfinished business. Guess, I don't know if there's any updates on NAV Center, Fair Court, Crisis Triage. You got anything? Navigation Center?
All I've heard from city and, well, actually both the owner and the city is they're close. That's all I have.
Is there any specifics on what close may even look like to us?
I've been begging for a timeline for a few months now, Vernon. Begging,
Alright.
begging, really.
Is this almost in a breach of contract? I'm asking a straightforward question.
Well, not the way our lease is written, it wouldn't be in breach yet.
We must be getting close to it.
We are waiting for an amendment to be signed that will include a timeline for a schedule for the work.
Okay, thank you.
Yep.
Thank you, Connie. Hair court, I know we'll have a lot to talk about next month, but I don't know if there's anything. What's the number of referrals we're at right now? Were we at 14 last time?
Yeah, it's a little higher. I think we're 17 to 19, something like that. And I think we had 2 or 3 with care plans, just off the top of my head. So we have a lot that are getting dismissed. For one reason.
Right. New program, more to find out. And crisis triage center, any new drawings or? More money.
Yeah, more money.
Yeah, more money. Good. Does anyone have any future items they'd like to hear about?
I know you're gonna dislike me and I'm sorry. Navigation summit. Being full uptick of that before too long.
I'd be interested at some point down the line to invite the folks that are doing the community class in Old Town on Tuesdays and Thursdays. What is that called?
Are you talking
Community
about?
Connections?
Uh-huh.
If they get to the point where they have data about that or anything to share out there, I know you're probably involved.
Well, I stopped by.
Yeah.
Yeah, I will ask Hannah Ozanian, who runs that program.
Yeah.
See if they have, she's got stats or.
It's a program in Old Town for community members to drop in and get connected to resources, but also do like things that are fun and community building.
Yes.
And she invited me to stop by anytime, and I think that would probably extend to other folks as well. Yeah.
Yeah. Thank you.
That'd be cool to hear from her.
All right. Nothing else. It's the time. What are we at? Oh, yes,
Before
13:59. I adjourned this meeting at 13:59.
Thank you, Laura.
Or two.
Yes. Yeah, I'm going to.
For the robust, really.
Yeah. I know. It's hard to repeat. It's just thinking about it. Don't take it. Don't do anything.